Welcome back. Hyperbaric Oxygen Therapy helps treat medical issues by using 100% or pure oxygen. It can treat a wide range of problems from carbon monoxide poisoning and severe burns to certain types of hearing loss, and it can even help deep sea divers affected by rapid changes in pressure. So Dr. Priya Asija is a wound care expert and a hyperbaric oxygen therapy physician at SAAK Health. Today, our focus is on how this therapy helps wounds heal faster. It's always great to see you.
Thank you for having me.
So let's talk first just about hyperbaric oxygen therapy. I read, because I was doing a little research, all these amazing wide variety, diabetic foot even. It can treat so many things. It must just be that pure or 100% oxygen really has healing benefits.
Yeah, it's 100% oxygen under pressure.
Okay, so do people, you hear hyperbaric chamber. Is it sort of like a chamber that people sort of, do they breathe in the oxygen, or how is it administered?
It's acrylic chamber. It's called hyperbaric oxygen therapy. It's a long tube kind of a chamber, which is very comfortable for patient to sit in.
Okay.
And then the patient will breathe normally, and 100% oxygen is put under pressure, 2 atmospheric pressure to be on average.
Wow. You have state-of-the-art exam rooms. I know this because I was there, and that's when I first met you. But really, you have such a beautiful facility in Brookfield for this state-of-the-art therapy and just even the diagnosis part and treating patients there.
Yes, we have everything under one roof. So we are very fortunate to have imaging, vascular backup, oxygen therapy, and the other things like cellular tissue products to treat the wounds.
One of the other things that I really appreciate about SAAK Health is how convenient you make it for patients to not only make the appointment, but parking is easy, getting into the building is easy, and then once you're in, you see top specialists in different fields, including you, and your specialty is wound care, which is incredible to see specialists in such a convenient way, I feel.
Yeah, accessibility is our mantra. So basically, when you go to large health system, a wound care clinic would be in a basement, or
right.
A patient has to walk 5,000 steps to go to see a doctor. But for us, less than 200 steps. You come in, you do your therapy, and you get out. So that's what we are making healthcare accessible to our patients in real terms.
And I know that's why you came together with the other specialists at
Correct.
SAAK Health, is because you wanted to provide this. You've been other places, and this was a goal for you. So let's talk a little bit about the treatment plans, specifically for you in wound care, how that works for patients, and how you make it really patient-centered or focused.
So these patients have chronic wounds. So it's not just a nick or a abrasion or something like that. This is long-standing wounds, and wound care comes when these become more than they're festering. There's a cause behind it, and when we start to investigate the cause. Is it because of lack of blood supply? Is it because of diabetes? Is it because of radiation? Is it a burn? These things help you.
Yes.
And then we have a diagnostic, that means imaging study, and a vascular backup. We can do arteriograms, we can do stenting here to take care of the cause of the wounds. Then the wound care aspect, the wound care comes in the process where I come in and I will treat the wound with serial debridement, give them specialized dressing for 4 weeks or so. If it doesn't help that much, then we go to hyperbaric oxygen therapy and also specialized dressings like cellular tissue product, which is basically grafts of skin grafting.
Okay. Obviously, you do the most conservative things first.
Correct.
And then if it doesn't resolve the issue, then you graduate to some of these other procedures and treatments to try to get the outcome that you desire. The hyperbaric oxygen therapy, is it quite accessible for people? And are people starting to hear about the fact that you have it there right on the premises?
Yes, yes, it is pretty accessible. For a patient who has diabetic wounds or chronic wounds, it is usually once every day for 40 treatments. So we do Monday to Friday, 5 days a week for 2 hours.
Wow. Yeah, that's a lot. But that must be what's needed in order to resolve a wound that's been long standing.
Yes, and it is very difficult to regenerate the skin. So you have to understand at the cellular level, you have to get this tissue back. So with oxygen, it reduces inflammation, swelling, promote growth factors, and increase blood supply to the wound.
It's wonderful work that you're doing there. It's great to see you again. Thank you so much for being here. And right now I want to mention this special offer that you have, which is fantastic. So SAAK Health is offering this great deal for just $200 cash. With that, you're going to get a consultation with Dr. Asija, followed by an hour in the hyperbaric oxygen chamber. Not all wounds, of course, are the same, so you need to visit SAAK Health today for personalized treatment and try their hyperbaric oxygen therapy. The beautiful new campus is located on Capitol Drive in Brookfield, and you can call 262-444-5148 or visit SAAKhealth.com for more information.